Welcome back, everyone. Hope you had a great break. So our next presenter is Megan McDonald. Megan McDonald is an epidemiologist with the State Systems Development Initiative team at the Florida Department of Health. She's within the Division of Children's Medical Services and works very closely with the Child Abuse Strategy team. Mrs. McDonald has been involved in public health research and practice for over 10 years and specializes in maternal and child health epidemiology. She works closely with Florida's CADR program to provide data analysis and epidemiologic consultation to support the program's statewide efforts to prevent child fatalities. Before joining CMS, Mrs. McDonald served as an epidemiologist in both maternal and child health and chronic disease prevention areas at the Florida Department of Health. It is a great pleasure to introduce Ms. McDonald as she presents today on suicide among Florida's youth.
Okay, good morning, everyone. Thank you, Josh, for the introduction. So today, I am going to share with you an analysis that we did in the epidemiology unit looking at recent increases in suicide mortality among children and adolescents in Florida. So suicide represents a significant and growing public health problem in the United States and in Florida. Nationally, it's the 10th leading cause of death overall in the US and the 8th leading cause in Florida. It is the 2nd leading cause of death for persons between the ages of 10 and 34 nationally. And in the US, we've seen the suicide rate among persons ages 10 to 19, so children and adolescents, has increased by 58% from 2007 to 2019. We also see that suicide attempts are increasing. Among youth in the US, suicide attempts increased between 2009 and 2019. And looking at some data from Florida's Youth Risk Behavior Survey, which surveys Florida's public high school students, 16% of those students responded that they had reported seriously considering attempting suicide in 2019. 12% had made a plan on how to attempt suicide, and 8% reported that they actually did attempt suicide. So some of the factors that increase the risk of suicide include psychological disorders, particularly mood disorders like depression and substance abuse. The risk increases when these things are, when those disorders are present together. Prior suicide attempts is another important risk factor. Social factors, including family adversity, family history of mental health issues, poor communication within a family unit, domestic violence, ACEs, and social isolation. Additionally, personality characteristics in the individual, such as impulsivity and poor problem-solving skills, lead to an increased risk. And of course, the availability of means for suicide, such as firearms and medications, is an important risk factor. Some things that reduce the risk of suicide include coping skills and problem-solving skills, those individual level factors, social support, availability of mental health services, and more limited access to means of suicide among persons who are at risk. So Abby in her presentation mentioned the importance of supplementing your case fatality review data with other data sources. And that's what we did here. We actually used the Florida Vital Statistics death records so that we could get a whole population view of suicide deaths in the state in children and adolescents. And so we did that by extracting all the death records from the Florida Vital Statistics database, which were identified by ICD-10 cause of death codes, X60 through X64 and Y87, which just represent different means and methods and types of suicide. And then as the denominators for the rates, we use population estimates from the Florida Legislature Office of Economic and Demographic Research. And most of these data came from Florida Health Charts, which is a publicly available data query system. For some of the data, I pulled the raw data to do deeper, to look at some methods which weren't available on charts. So what we did was using the resident deaths from 2005 to 2019 among persons ages 10 to 19 years. We calculated suicide death rates as the number of deaths per 100,000 population. We conducted a trend analysis during this time period using JoinPoint software, which is the same software that's used by, I believe, the National Cancer Institute to look at incidence and mortality trends. It uses a statistical test called a permutation test. And then I used an open source tool online called OpenEpi to calculate chi-square statistics to test for significant differences between groups and other parts of the analysis. And then we additionally did some analysis in Stata. So these are the suicide death rates for children and adolescents 10 to 19 years old from 2005 to 2019. The overall death rate increased by 23% from a rate of 4.3 deaths per 100,000 population in 2005 to 5.3 in 2019. And this was a statistically significant increasing trend. And just to give you all a little bit more information, I know sometimes rates tend to be not that meaningful, except to serve as a means of comparison between one measure and another. But to demonstrate the magnitude of this issue, the numbers that those rates are based on from about 2005 to 2012, we saw an average of about 87 suicide deaths per year for this age group. And then more recently, from 2013 to 2019, the average number of deaths per year was about 116. Just to give you some basis for those rates that we're looking at and kind of comparing the changes over time. So additionally here, we ran the trend analysis by sex and looked at the rates for males and females. And what we saw was that, as you can see clearly here, the suicide death rates for males are consistently higher than the rates for females. And the rates for males during this time period increased by 20% from 2005 to 2019. And for females, the rates, while being smaller in comparison to the rates for males, increased by 33% from 2005 to 2019. And this is sort of denoted by indicated by the data notes that you see below the graph, but these were all statistically significant increasing trends across the board. So we also looked at the rates separating out this population of children and adolescents into younger and older. So we looked at 10 to 14-year-olds and 15 to 19-year-olds, and you can see the large difference in the rates between these two age groups, with that being highest among the older age group. Which during this time period, the rates for 15 to 19-year-olds increased by 21% from 2005 to 2019. And although the rates were lowest among 10 to 14-year-olds, there was also a significant increasing trend for this age group. Overall, 38% increase during the time period. So when we looked at the suicide death rates by race and ethnicity, we observed statistically significant increasing trends in this time period for all groups. All groups were statistically significant except for non-Hispanic Black. The suicide death rate was highest for non-Hispanic white children and adolescents at 6.8 deaths per 100,000 population. And Hispanic children and adolescents had the lowest suicide death rate. So looking at the methods of suicide over time, all method-specific rates of suicide death increased significantly during this time period. The leading methods of suicide over the entire period were firearms and suffocation, and these two methods accounted for 86% of all suicide deaths among children and adolescents in this age group. Suicide involving firearms was the most prevalent method for this population, outnumbering suicide involving suffocation. The rate of suicide by other methods, which includes things like poisoning and other types of methods, doubled over the time period. So these next charts I'm going to show you are comparing the percentage of suicide deaths by method across the demographic groups for which we just saw the trend analysis. So looking at sex or gender, we saw that there was a higher percentage of suicide deaths due to suffocation and other methods, 50 and 22% respectively, among females compared to males, where about 38% of males committed suicide by suffocation and 12% by other methods. And the leading method for males was firearms, which accounted for approximately half of all male suicide deaths. So looking at these two age groups, again, we saw that there was a higher percentage of deaths involving firearms among children and adolescents ages 15 to 19, so that older age group, about 46% involving firearms, compared with the younger age group, 10 to 14 years, where the percent involving firearms was 34%. Among this younger age group, 10 to 14 years, suffocation was the leading method of suicide, and this accounted for about 57% of all suicides.
We have a question.
Oh, okay, I'm sorry. What is the mechanism of self-suffocation in this age group?
So they can't see the question, if you could repeat it.
Oh, I'm sorry. What is the mechanism of self-suffocation in this age group? There may be more detail looking at the individual ICD-10 codes. I honestly, right now, I don't recall on an individual code basis, but I could take a look at that information later and follow up. Would this be hanging? Yes. Yes. Okay. So again, among the younger age group, 10 to 14 years, suffocation was the leading method and accounted for 57% of all suicides, and other methods of suicide were more prevalent among those aged 15 to 19 compared to the younger children and adolescents. And so next we looked at method by race and ethnicity. And we saw that the percent of suicide deaths involving firearms was highest among non-Hispanic white and non-Hispanic Black children and adolescents, accounting for respectively 48 and 44% of all suicide deaths in these groups. Suffocation was the leading method among those with Hispanic ethnicity, also making up about half of all suicides in these groups. So in summary, what we learned from this analysis of data was that from 2005 to 2019, suicide rates increased significantly among Florida's youth, children, and adolescents. We observed these significant increases across almost all demographic groups, with a total increase of 23% in the overall suicide death rate, which was approximately a 3% annual increase. And all methods of suicide, including firearm suffocation and poisoning, contributed to this increase. The highest suicide rates were observed in males, non-Hispanic white individuals, and older adolescents between ages of 15 and 19. And the rate of suicide involving firearms was the highest among the different methods. So, and that concludes this presentation. Thank you so much. I'd be happy to take any other questions you may have.
Thank you, Megan. So now we'll open it up for questions. I see we do have one in the chat from Dr. Perry. Does the suffocation include drug-induced asphyxia?
I believe that a drug-related suicide death would be included under poisoning. So in that other group, I'm not absolutely sure, but I'm pretty sure usually drug-related deaths can fall under type of poisoning. But I can get the breakdown of the ICD codes that we use to pull the records.
So we have one that's scrolling. We may have to facilitate for you. Okay, we'll use this top one.
Okay, so we have another question. Is there information regarding multiple attempts of suicide and links to follow-up services for treatment and successful treatment follow-up? Wondering if there is information on success of community resources to prevent future suicide attempts.
Yeah, so from a data perspective, I believe we could get a look at suicide attempts from the emergency department data records. Those we wouldn't have that in mortality data, but yeah, I mean, hospitalizations and emergency departments for suicide attempts, those data are available.
Do we have any other questions or comments at this time? Hearing none, please, feel free to email Megan or any of the CADR program office staff. Her email is here on the screen now, but and then you all know how to reach any of the CADR staff. So please feel free to answer any questions or ask any questions at a later time as well.